pleasure to be able to address you. Can you hear me well enough in the back?
Yeah.
Well, I'm going to speak to you tonight about radon exposure and lung cancer. And I'm going to show you a similar map to Jeff Zimmerman's. You can see all the pink regions are areas that have very high picocurie concentrations in the United States. And the Marcellus Shale area up in the northeastern area includes a big segment of New York State as well as Pennsylvania and moving down into western Virginia. And it's from this area that they are expecting to take natural gas, as Jeff mentioned to you. So first of all, how does radon get into our homes? Two ways. One, as a normally occurring radioactive material, and we've kind of nicknamed it NORM, radon seeps into foundation cracks, the foundation of your home, through walls and through water pipes. And this contributes to background radiation to which we are all already exposed every day. A certain number of picocuries or picocuries that we consider background and that no one has ever really classified for us as how safe it is or isn't. The second way is as a component of natural gas. Radon can enter our homes as a component of natural gas because radon is a part of natural gas and it's intentionally delivered into our homes for gas stoves and gas heaters. So current supplies of natural gas have low levels of radon because the radon has traveled long distances, usually from Louisiana and Texas, as Jeff has already told you. And in that period of time, the radon has been able to begin to decay, so it's less radioactive by the time it gets to New York. I'm going to just mention briefly one group of the radon progeny. And I guess as a woman, I think women don't like to be thought of as radon daughters. It sounds kind of evil. So, science has renamed it radon progeny. And the 210 class includes lead, bismuth, and polonium-210. Lead actually does have beta decay, but also alpha decay. But the most important one that I want to focus on is polonium-210. It is an alpha decay substance, and it has a relatively long half-life of 138 days. Now, you may all remember, I think everyone in this audience may be old enough to remember back to 2006, when Alexander Litvinenko, a Russian spy who had sought political asylum in Great Britain, was assassinated by KGB officials using high-dose exposure to polonium-210. So this shows you just how dangerous this can be. But it's important to remember, the take-home point here is we're not all going to go home and turn on the stove and die within 3 weeks like Alexander Litvinenko. Clinical effects are dependent on dose and duration of exposure, and chronicity of low-grade exposure may also be important. Well, how do radon progeny, or daughters, get into the lungs? What's the route of exposure? The route is mainly inhalation, although it can enter through the mouth as well. In any event, it passes through the nasopharyngeal passageways and the oropharyngeal passageways and moves on down the tracheobronchial tree. You can see the trachea with lymph nodes attached to it on the side, branching off into the right lung and the left lung. And you can see a kind of a white, stellar-looking area in the upper left lobe, which is a tumor, a lung tumor that has formed. And you can see the circle around lymph nodes that have been colored black on this schematic diagram to indicate metastatic nodes. Well, first I want to say that this slide is just a tiny bit misleading. Cancer doesn't happen this fast. You don't breathe in radon progeny and have it, dip down into your tracheobronchial tree, get into your lungs, and wake up the next day or the next week with a tumor. it takes a long time. There's a long latency period between exposure to radon and its progeny and the clinical development of cancer or tumor. So let's have the briefest course in history on what carcinogenesis is all about in regard to radon. With radon, the alpha particles, which are the decay particles, can directly cause DNA damage. In addition, they can also cause free radicals to occur, and free radicals can also cause DNA damage. Now, when the DNA is damaged, it doesn't always mean that there's going to be a mutation, because we have built-in mechanisms for DNA repair, which is what keeps us going so long. But sometimes it's not effective. So you can have cell death, which is actually another built-in thing that helps protect us from the development of a tumor. If a cell is knowingly mutated because of alpha particle action, then programmed cell death called apoptosis will occur and will take that sick cell basically out of the playing field. So no tumor will grow. But sometimes that doesn't happen either. Sometimes there's no programmed cell death, and so a mutation begins with just one cell. And then you begin to get slow proliferation of mutated cells over a long time. And this leads eventually to tumor development. There's no single mutation that leads to tumor development. Multiple factors are involved, and these are things called epigenetics and resiliency of the patient. And don't forget the long latency period that exists between the initial exposure and the tumor development, which could be decades. This is just a quick picture of the DNA being damaged by radon and radon progeny. Radon and tobacco smoke have a synergistic effect. You all know that cigarette smoke is very dangerous. It's the leading cause of lung cancer. Approximately 90% of cases are due to cigarette smoking. Radon is the second leading cause of lung cancer, about 10%. Radon, however, is the leading cause of lung cancer among non-smokers. So exposure to radon alone at any level may pose a risk of lung cancer. And then if someone is also a cigarette smoker in addition, the risk is 10 to 20 times higher. Important to keep in mind is secondary smokers, those who've never actually smoked themselves but have been exposed as passive smokers. They are also at greater risk, and the synergistic effect is in play there too. The most vulnerable population of all include children. Children are the most vulnerable because they have a greater exposure to inhalational agents because, first of all, they breathe faster. They have a faster respiratory rate per kilogram of body weight than adults do. Additionally, they may not yet have a well enough developed immune system. And in addition to that, they're very young, so they have many more years of future life ahead of them, within which a cancer with a long latency period can develop. There are other vulnerable groups too. People with pre-existing pulmonary diseases like asthma, fibrosis, COPD, which is chronic obstructive pulmonary disease, and chronic bronchitis. Also, people who have other chemical exposures, like to arsenic, asbestos, benzene. Some of these products are also products that will be exposure risks with fracking. Elderly people are also another vulnerable group. The EPA has estimated that deaths due to radon are about at least 21,000 per year. And this is actually more than we see for drunk drivers. And you know that news about risks from drunk drivers or from falls in the home is frequently in the newspaper, but we hardly ever hear anything about radon in the house causing this many deaths from lung cancer. So let's talk briefly about lung cancer. This is a devastating disease. It's the most common cancer in both men and women today, surpassing breast cancer in women, prostate cancer in men, and colorectal cancer in both. Approximately 50% of patients die within 1 year after diagnosis, and that's because it's not diagnosed until it's already advanced and metastatic. The 5-year survival rate is the lowest among all cancers, only about 16%. And the period of suffering is extremely great. So the impact upon patients who have lung cancer, their loved ones who watch them suffer, and those of us in the medical and healthcare fields is very, very profound. Social responsibility is an important issue, and I'll mention it briefly. What do we have to do? We have to protect our neighbors. We have to protect New Yorkers. It's one of the greatest cities in the world, and we have to protect the people who live here and make this city great. We have to minimize exposure risks to known public health threats such as radon. And in summary, I just want to say that the increased delivery of natural gas to New York City apartments is a serious public health concern because it will increase the background level of indoor radon. It will increase exposure of New York City residents to radon. It will increase the incidence of lung cancer among New York City residents. And it will subject specific vulnerable populations to increased cancer risk, including children, all of our future generations, and people with already existing chronic pulmonary diseases, people with other chemical exposures, and especially direct tobacco smoke and environmental passive tobacco smoke. Thank you very much.
Actually, I encourage you to get emotional. I think the prospect of radon with your coffee is one I can certainly get very emotional about.